Welcome everyone to our webinar hosted by Drug Free America Foundation, supported by the Florida Department of Health. The program today is entitled Substance Use Treatment During Pregnancy and is part of our Marijuana and Pregnancy Educational Project. My name is Medina Naviduka, and I'm the Program Coordinator for Drug Free America Foundation. We have a few housekeeping items to address. We encourage you to write your questions in the Q&A box. The final 10 minutes or so will be devoted to responding to your questions. The webinar will be recorded, and you will receive a link to it along with the PowerPoint presentation and a certificate. The survey will be sent following the webinar. Please complete it as soon as possible. So let's get started. Here is a brief bio on our presenter. Sabrina Pooran has worked in the field of behavioral health for more than 20 years. She graduated from Argosy University in 2008 with a master's in mental health counseling and completed her postmaster's internship while working with families in the child welfare system with addiction disorders. She is a licensed mental health counselor and certified addictions professional. In addition to being trained in child-parent psychotherapy and a facilitator for safe baby and nurturing parenting. Sabrina oversees the Family Services Department at Cole Behavioral Health in Tampa, which has programs dedicated to working in the community with child welfare families and residential programs for women, with a focus on pregnant and postpartum women in the community. Sabrina has served on various state and local stakeholder groups addressing the integration of behavioral health and child welfare. Sabrina has trained local community members on pregnancy and behavioral health. Sabrina is a strong advocate for children and families with behavioral health needs and believes that with wraparound services and coordinated care, families can be strengthened and healed. Welcome, Sabrina.
Thank you, Medina. Hello, everybody. I'm just going to go ahead and share my presentation. All right. As Medina said, my presentation is about substance use treatment during pregnancy. I am the Director of Family Services here at Cove Behavioral Health in Tampa, Florida. So just a little bit about Cove before I get started on pregnancy. Cove Behavioral Health was formerly known as DACO Behavioral Health. We have been a private not-for-profit leader in behavioral health in Hillsborough County for over 50 years. We have won state awards for best residential treatment and prevention services and national awards for comprehensive coordinated care for pregnant and postpartum women. We are co-occurring mental health and substance use services. 2 years ago, we changed from just substance use to actually providing co-occurring services for our community. We have multiple levels of treatment offered from our intervention level services, Medicaid assisted treatment, outpatient treatment, health services, and residential services. So what you're all here for is our pregnant women. So some of the things that we have seen with pregnant women over the past few years have been highly concerning. There has been less focus on pregnant women during and after COVID. So our agency, previous to COVID, saw 70 to 80 women a year that were pregnant and seeking treatment services. They would come from multiple referral sources, whether it's from jail or community partners or referring themselves. Once COVID hit, there was a significant decline in women seeking services. So this has been going on now about 3 years, and we were very concerned with what is going on because the number of substance exposed babies were still the same. What we were finding was that women were not seeking treatment services and they were not seeking prenatal care. We partnered with a lot of community partners and spoke about this issue and are continuing to try and outreach pregnant women and try and get them into care as soon as possible so that there are less harmful effects to their babies. During this time, We also found that our jail systems were not keeping pregnant women. So typically in the past, we would get direct referrals from our court systems for pregnant women requiring treatment services. But during this time, our jail systems were not keeping pregnant women in jail due to the risk of COVID and were releasing them quickly. So there was another portion of the legal system that was letting us down and not allowing us to treat the pregnant women. This resulted in, of course, a lot more babies being born substance exposed and a lot more removals at birth. All right. So a couple of the programs that we have here at Cove that are specifically for pregnancy are our Zero Exposure Program and our Family Treatment Services. So I'm going to go into some detail and describe them. And then if you have any questions, just drop it in the chat and we can talk about them at the end. All right, our Zero Exposure Program, this is just to get you guys all warm and fuzzy. There's our babies. Our Zero Exposure Program is to help moms have a substance-free, healthy pregnancy. So what we do is, as soon as we find out a mom is pregnant, we enroll them into our Zero Exposure Program. We outreach them in their homes or in the agency, and we offer them these services. So during the services, they are provided monthly pregnancy education. We have folders which we provide to them and we update regularly with what they can expect that month, in addition to providing them resources such as what to expect when you're expecting or other resources in the community. We also provide transportation to OB appointments. As most of you are probably aware, there's been a really hard time for women to get into OB appointments, especially that first one. So our pregnancy case managers, they reach out to OBs that we have created partnerships with in our community, and we try and get their appointments scheduled as quickly as possible. As you know, some of our OBs don't like to work with high risk moms, so we have a specific partnership with Genesis through Tampa General that do work with our high-risk moms, and they go ahead and see our women and help them get the care that they need. Sometimes we don't have a woman who gets into services until she's 5-6 months pregnant and she hasn't had any prenatal care. So it takes a lot of intensive case management to try and help these women get the things they need for their healthy baby. Once we are connecting them to OB care, we are transporting them if necessary. Some of our women do live in our residential units, which you'll hear more about in a minute, but we'll take them to all of their appointments. Once an appointment takes place, we'll go ahead and contact the OB just to make sure that they've attended the appointment and what the outcome is, so we can help support them during those monthly visits. Another thing that we do is we complete a pre and postnatal depression screening. So we do the Edinburgh screening. We do the first one about 24 to 36 weeks out of pregnancy. And then if there are any high scores, we'll go ahead and refer to psych services or community providers. So we also have psych services here at Cove. So we'll refer to psych services, or if they're in one of our treatment programs, we'll also connect to their counselor and say, hey, they are high alert for postpartum and prenatal depression, so please address during their treatment plan. Once mom delivers the baby, we'll go ahead and coordinate with the hospital and visit the mom in hospital during the delivery. Again, we'll coordinate prenatal as well as postnatal follow-up. We are funded through the Children's Board of Hillsborough County, so we are able to access some funds through their ASO or Administrative Service Organization to provide needed baby items. So a lot of our moms have no resources, so we can provide them with a pack and play, a stroller, bottles, formula, not formula because we help them sign up for WIC, but bottles, anything that they might need for the baby to keep the baby safe. And we also help coordinate pediatric care for the newborn and developmental screenings that are completed at 2 months. This program is also a partnership with Champions for Children, which are on site and provide a lot of the developmental oversight for the babies, and provide some support groups for the moms while they're going through the first few months of having a baby or even being pregnant. In the corner is 2 of our pregnancy specialists and a newborn baby during one of our mom activities where we let the moms do their nails and have a spa day, and we were holding the babies to support that process. And then the top photo is where we took them all to a pumpkin patch so they can enjoy a day out with their babies and kind of learn how to work in the community with changing diapers and formula and packing a diaper bag. All right. So this is our Family Treatment Services program. It is a residential program that is here at Cove in Tampa. It is a SAMHSA funded program. What that means is that there is no cost to the individual. It is completely funded. And we work with community partners to serve pregnant moms and moms up to 1 year, with babies up to 1 year in need of substance use treatment. So the only criteria is that the mom has to be pregnant or have a child under the age of 12 months. If the child is not in their care, we can still take them into our program while we work on the goals of reunification. The only thing for this program, it isn't a housing shelter, it is a residential program, so they must meet criteria for residential treatment. And we have ways of working with you guys if you did want to make referrals on how we would screen for residential treatment. And they must be willing to participate in a 6-month program. So this is our campus where the program is located. On the left is our duplex. So it's really more fun when we do an actual tour of this. So I tried to represent this as virtually as possible and kind of show you guys what we have out here. This is our duplex. There are 2 duplexes. Each duplex has 4 bedrooms, a living area, a kitchen, and one of the duplex has a space for staff. So staff are called family support specialists, and they help support the mom through the treatment process. They are there at night when mom needs extra help holding the baby or just needs an extra couple of hours sleep and baby is having a hard time. Our family support specialists actually sit inside the duplexes and they check the moms every hour to make sure baby is safe. They are also trained in the Safe Baby curriculum, so they know about safe sleep, safe caregiving, and just overall how to keep the baby safe. The image on the right is kind of an overview of the side of the duplex and kind of the length of it. We're at the back of the campus and our traditional women's residential program is on the 2nd floor. So we do keep the moms and babies separate from the rest of the building. Oops, sorry, going too fast. So some of the things that we do in the program, it's comprehensive residential services. So we are doing substance use treatment and groups, which includes anything from grief and loss, recovery 101, women in recovery. We are using evidence-based treatment. So any curriculum that we are using has been vetted and is okay to use. We're not just throwing things at the wall and seeing what sticks. We actually have actual curriculum that is approved through SAMHSA to use in residential treatment. The goal of the treatment is to improve parenting skills, economic stability, and family functioning. So we aren't just focusing on the substance use of the mom, we're focusing on them as a family. So that it also includes any family members that might be involved with the mom, whether it's the baby's father, whether it's the grandmother, whether it's an aunt, whether it's a close family friend. We want to try and have as many people as possible supporting the mom through her treatment process. Many of the times our moms come in and they have estranged family because of their drug use. They've managed to alienate family members. So we work on building those relationships and finding good supports for the mom so that when she leaves our program, she has enough people to help her raise that child, because as we know, it takes a village, so she can't do it by herself. We have wraparound services here to include medicaid assisted treatment. So our medicaid assisted treatment, we have physicians on site that are familiar with working with pregnant women and understanding how to medicate them appropriately so mom and baby continue to stay safe throughout the pregnancy and during delivery as well. And then after delivery, they work with the doctors to manage the medication dose and come down if needed, or even if they don't, to stay on a stable dose so they can still parent their child without having a hard time or going through withdrawal. We also have, I mentioned mental health on site. So we have psychiatrists. Every mom that comes in gets a psychiatric evaluation and is put on medication if she needs it. That is safe for the baby. So our physicians are very comfortable prescribing for pregnant women. We also have primary care on site for our residents. However, our pregnant residents do go to their OB for primary care, as it's specialized and we need to have additional services for them. Family screening for behavioral health. So if we are working with a family and the dad may have his own addiction issues, we're going ahead and referring him to treatment so that he can become healthy as well and he can be a good part of the baby's family. We have optional HIV testing on site and smoking cessation. So a lot of our moms come in and they're smoking prior to coming in. We are a no smoking campus. So when they do come in, we do offer them the opportunity for smoking cessation. As we know, it's healthier for the babies. They have access to nicotine gum as well as nicotine patches, but they're also taught the proper way to use it and given skills to be able to come off those cigarettes as well. It's really hard when you're trying to stop using substances to also stop using cigarettes, and it's a shock to their system. So we try and support that process for them, as well as doing a weekly group where we can encourage them to stop smoking. We also do meditation in related to that, as well as acupuncture. They have an option to do acupuncture to help them with the cravings for nicotine. So this is a look inside one of our duplexes. As you can see, it's set up like a family style home. There is a living room, dining table. All of the meals are served here in this inside the duplex. The women eat together and they try and do a family-like atmosphere. The very far left picture, you can't see that well, but there is a stove in there. So we have a cooking program once a week where we will have staff work with the women on creating something healthy. So they learn how to create healthy meals once they leave the program for their kids and for themselves. A lot of the women, as you can imagine, when they're using substances, they don't eat very well. So we try and teach them that A, they can have fun cooking, and B, they can create healthy meals. They also have the ability to use WIC and buy healthy items for themselves, and we kind of encourage them on how to nurture themselves and nourish themselves and their baby if they're nursing. So we have a setup, and then the moms decorate their own rooms. If you can see the two pictures to the right, they are given a lot of equipment for the baby, like the pack and play, and they make the rooms look homely. They are single occupancy if they do have their babies. So we never have a mom with a baby and another mom in the same room. There's always single occupancy. I'll just leave those up for a couple minutes because they're warm and fuzzy. You guys can take a look and okay. All right. Some of the specialized practices in this program, I mentioned earlier briefly, we have programming specifically designed for pregnant women and new moms. So what that means is our schedule is designed to accommodate pregnant women. We have a built-in nap during the day. So in the afternoon, they get to rest. We have parenting programs. We have a new moms group. We have a developmental group. So during the day, although we do have the required number of clinical groups to help them get what they need, we also understand that some of these moms are up during the night. They're taking care of babies, so they might need an extra rest during the day. So we do provide that for them. And the schedule is really built around having more clinical in the morning where they are actually awake and able to concentrate a little better. And then in the afternoon, the schedule tailors down to more client-led groups, or doing an NA meeting or doing a game day, or just something to kind of help them relax as they go into the evening. We also do a kind of relaxed schedule on the weekends, but making sure they're still getting some clinical groups. Our recovery support services are really important to the program. So this is a peer support specialist or someone that has been in recovery themselves, and most of our peers are also moms, so they are able to talk to our moms when they come in the door and say, hey, I've been there, I've done this, you can do this, let's do this together. So what they'll do is the minute they'll walk, a lot of our women, when they come into the program, are really skeptical and they're scared. They don't want to be in treatment. They're scared to be pregnant in treatment. They're scared to have their baby in treatment. So our recovery support specialists will meet them at the front door and will give them, you know, a nice pep talk, and we'll sit with them throughout the intake process, because that can also be overwhelming, and just help them feel more comfortable that somebody understands what they're going through and how they can help throughout their treatment. And then in the treatment programs, they run a couple of groups from a recovery support perspective, and kind of educate the women on 12-step or other community supports that might be available for them when they leave treatment. Our recovery support specialists are really important, especially for moms that get here and want to leave, or, you know, kind of have some issues related to some of the old behaviors, and they are very helpful in pointing out how some of those behaviors could be damaging to their recovery and also to their parenting. So our recovery support specialists are really good at talking the mom's language, so to speak. We also have intensive case management for mom and baby. So the program has a maximum number of 11 beds in the 2 duplexes. So it's very much wrapped around mom and baby. As you can imagine, baby will have lots of needs getting to the pediatrician if there's any developmental issues. Mom also has lots of things that she wants to address while she's in treatment. A lot of our women have ignored many things that they could have while they were outside treatment, such as getting their driver's license back, or applying for Social Security, or taking care of, you know, a number of things. They also have the opportunity to start working and learning how to build some vocational skills and build a resume. So they do all of those things while they are here in treatment, so that when they leave our program, they have as much independence as they can and are able to parent in recovery with some good stability behind them. We do trauma-focused treatment. So basically what that means is we are treating each woman as they might have gone through something, and kind of understanding them. Rather than why are you acting the way you did, we say what happened to them to act the way they did and how can we help. So we do a lot of trauma groups. We have the availability to do ART, which is accelerated resolution therapy, for anyone that has been through traumatic events in their life, and kind of help the mom get through those times which are really difficult and which may have led to them using substances in the first place. I mentioned this earlier, but we partner with Champions for Children. And if you were taking a tour here, it would be a beautiful little childcare area with beautiful playground equipment. But Champions for Children provides a lot of services and support for our moms. They provide childcare for the baby. So while mom is going to treatment groups, they are able to go to childcare once they reach 6 weeks. Prior to 6 weeks, moms can drop off the baby for 2 hours a day just to get a break, take a shower, take a nap, whatever it is they might need during their day to be able to feel okay. So these are licensed childcare staff that are working there, and they're able to do those things for our moms. They also provide nurturing parenting for our moms. And as I mentioned, a new mom support group, developmental support group. But more than that, they are family educators that come in and help the mom. When mom might have an overwhelming night, they'll come in and they'll talk to mom, or they're, you know, just can't figure out how the baby can stop crying. They'll come in and they'll give mom some tips, or during the groups, they'll help, you know, hey, why don't you change the diaper this way? Or why don't we do this? Why don't we try something different? And they come at it from a non-treatment perspective, which is received better by our moms. They also do facilitated visitation. So if our moms have other children that aren't in their care here, older children, toddlers, we have visitation groups once a week where Champions for Children will do activities. So mom learns how to bond and engage with her other children. They can also have visits other times, but this group allows them the actual activities and directed for helping them bond. They also do our developmental screenings for children. So if mom has older children up until the age of 5, they'll do an ASQ, an ages and stages questionnaire, just to kind of see where the child is and if there's any additional screenings or developmental services that's needed. In our residential programs, we also partner with community agencies. So we have domestic violence victim classes that are brought in by the Spring of Tampa Bay. We take them to the art museum, Tampa Museum of Art, at least once a month so they can enjoy some art education programs, and that often inspires them to come back and, you know, figure out that they can do fun things while they are sober and create all kinds of magical works of art while they're here. We have equine therapy, so moms that are not pregnant are able to go to what we call the horse farm once a week, where they can do, they brush the horses, they get to pet the horses, and it kind of helps with reduction of a lot of mental health symptoms. We also introduce the women to NA and community support groups so they can find a sponsor. And if they don't want NA, they can do other groups in the community, as long as we can find ways to support them while they're here and then build a support system when they leave here. We just started child parent psychotherapy for moms and babies. So that's if mom has been through a traumatic event or baby has been through a traumatic event. We do specialized services that help them work through the trauma, and with the ultimate goal of attachment and bonding and having a better relationship with their child. So we've just started doing prenatal. So once mom's pregnant, exploring her feelings about the baby, exploring her past childhood, and seeing how that could impact her parenting her child as her child grows. So we couldn't do any of the work we do without partnerships in the community, and we've built some really great partnerships over the years. I forgot to mention this, but this is the 5th year of this program. And it all sounds nice and beautiful now, but there was definitely some teething issues at the beginning. So we have, with the help of our partners, been able to get through that. Our biggest partnership is with Tampa General Hospital and a USF neonatologist, Dr. Tanner Wright. So what we found is the women feel more comfortable when they're giving birth if they know what's going to happen to the baby. So we will take the mom for a tour through the NICU. Some of our babies are born substance exposed because they are on methadone and they go through neonatal abstinence syndrome. So they're not substance exposed from street drugs. They are on methadone to keep the baby healthy and safety. So the baby might go through some withdrawals when the baby's born. So we take the mom to the NICU and we have the mom tour the NICU and find out what might happen when the baby's born and what they would expect. That's reduced a lot of the fear that our moms feel when their babies are hooked up to all those tubes. And that can look pretty scary for a new mom. So being able to see what could happen reduces a lot of fear and anxiety for the moms. We also have Dr. Wright meet with the moms virtually or in person and kind of explain what to expect from the mom, what to expect from the baby when the baby's born, how to take care of a baby that might be neonatal abstinence syndrome, keeping the lights down low, keeping the sound, keeping the stimulation to a minimum. What does it mean when the baby's crying and how to soothe the baby? So they've done a lot of preparation ahead of time so that when the baby is born, we are able to help coordinate care. If the baby stays in the NICU for a prolonged period of time, we work directly with the hospital to figure out a good visitation plan. So mom is there for bonding and attachment, but also at the same time getting what she needs from treatment. So we'll create a schedule that works for each individual mom. No mom is the same. Sometimes we've let moms stay there overnight. Sometimes mom will say, I just need a break. I need to go take a shower. So we'll transport them back and forth. We've also worked with Plans of Safe Care here in Hillsborough County. We have a good working relationship, and they work with babies who are substance exposed up until the age of 5 in their PD clinic. And so we start that process and their referral early on. If mom comes in and might be exposed to substances, we'll start that referral and they will provide those overlay services. And then they also refer to us for our services. That also includes a partnership with Healthy Families, Healthy Start. So when mom leaves here or finishes with any of our programs, we have the ability to refer them to Healthy Families or Healthy Start so they can continue with case management services when they leave the program. We've also partnered with our Child Protection Investigation Division. we have actually deterred many removals at birth due to having this program, because our sheriff's office will call us and say, hey, can we place this baby and mom with you if mom is using? And we'll say yes, and they'll keep the mom and the baby together as a family. Or we've even had women in our program that have delivered that previously would have had their child removed, but because they're in their program, they've been allowed to keep their baby. So we've had over 10 successful family maintained units because of the program. So some of our successes, 100% of babies born in the program are substance free. So when I say that, I mean they are not on illegal street drugs. When they're on medication, we don't consider that being born substance exposed because it is medically monitored, and the withdrawal is medically monitored at the hospital. We have a 67% successful treatment completion rate. And if you know, completion rates for substance abuse is typically 30 to 40%. So it's a pretty good successful completion rate. Of course, we have women that are not ready that will elope from treatment. We had a lot of that during COVID because we had to restrict visitation. So that actually brought down our successful treatment completion rate. And we also have women that just aren't ready for services and may be a detriment to the community. So they have to be discharged. That's very few and far between. Some of them do elope though, because they want to be with their families or they're not ready for services. We have a stringent evaluation process through USF. So some of these outcomes are from the evaluation tools. So there has been a decrease in substance use from baseline to follow-up, increase in management of mental health symptoms from baseline to follow-up, including a reduction in PTSD symptoms, and an increase in overall parenting skills as assessed by the adult adolescent parenting inventory, which is done both by our champion staff and by USF when completing evaluations. And as I mentioned earlier, we divert several babies from being sheltered at birth due to placement in the program by Child Protection. So I know I've thrown a lot of information at you guys, and we're finished a little bit early. So I hope there are lots of really good questions. And I will stop sharing so you guys can shoot out the questions.
Thank you so much, Sabrina. You have a wealth of knowledge on this critical and sensitive topic that I'm certain was very appreciated by our participants. So let's get started with our questions. So remember, if you have a question, please use the question and answer function, and I'll look through it and I'll ask Sabrina the question. So let's see what we have. So I'm going to give some of the participants some time to post their questions. Let's see. So one is, are your services only open to moms in Hillsborough, or are there any other areas?
We are open to other areas because this is a federally funded program. We will take moms from other counties or even out of state if they are meeting criteria for residential.
Awesome. Okay. Okay, she just answered this question. And so as more questions are going to pop in, I'm going to have a question too. Oh wait, Nathaniel has a question. Is this program covered under insurance, or is anyone available for services?
Sure, it's a SAMHSA funded program, so they do not need to have insurance to be in the program. The insurance, if they have Medicaid, will cover their medical services, but everything else is covered under the program through SAMHSA.
Nice. So then can you go over the process of how do you refer a client?
Absolutely. So the last page of my PowerPoint, which I think Medina said she would send out, has our contacts. So if you were to refer a mom or a baby, there is an FTS info email address. So you can go ahead and send an email and say you're interested in referring. Once you reach out, either myself or the program supervisor will reach out and speak with you, and they will instruct you to send a referral packet. So if you have a mom that's enrolled in, for example, another program or is seeing another clinician, you can send clinical information to our admissions department, and we'll walk you through that process once you reach out and make that referral. And we then screen them at our admissions department virtually. We'll review the paperwork, make sure they're medically appropriate, and then we'll schedule them for an evaluation. As I'm sure all of you are aware, pregnant women are priority population. So we try and move through that process very quickly. And if you don't have any clinical information and you just want to make a referral, but you don't know how to get started, again, you just email that email group and we will walk you through it step by step.
Mhm.
We try and make it as easy as possible and not too many steps to have to get through.
Yes, and I'd like to repeat to please put the questions in the question and a function box, not the chat, but the question and answer. All right, so to continue, are you using a formal pregnancy medical home model?
No, we're not.
Okay. And then what is the criteria for residential?
Sure. We follow the American Society for Addiction Medicine criteria for residential. So they would need to meet that 3.1 level. We don't expect you guys to figure it out. But honestly, if somebody is pregnant and using substances, they are going to qualify for residential services because pregnancy is one of the top priority populations, and the use of substances that will harm another individual will meet criteria for residential.
So next question, is medical marijuana use allowed in this residence facility?
No, and that is due to the fact that SAMHSA, who funds us, does not recognize medical marijuana as a medicine at this time.
Okay. Do you have a long waiting list?
Not at this time. Like I explained, pregnant women are priority. So even if we were full in our duplexes, which we only have 11 beds, we have a women's residential unit that we will put overflow in until beds open up in our duplexes. And we haven't been full in 3 years. So we've been able to accommodate women pretty quickly into our program. And when I say pretty quickly, I'm talking about a week or two turnaround at most.
Okay. And then if moms are pregnant and have another baby, are they accepted in your program?
So we have space for another child. What we usually ask is mom is bringing in another child. We want you to get settled into the program before bringing in that second child. And we are going to limit it to an age under 2 because we don't want older children in our program. It's harder to manage older children. And we also have to look at childcare options. Our childcare options can only take the younger kids. So we want to make sure mom gets the services she needs without having too much interference from another kid. However, we've had 2-year-olds in our program as well. So yes, other children are welcome, but it's very limited because we have 1 room per mom. So we've only been able to fit a mom and a toddler and a baby in a room. We also have options for extended overnight visits. So for example, if mom has a 7-year-old and wants to have an overnight here and there, we have bunk rooms. So mom could go on the bottom, child can go on the bottom, mom can go on the top, and if we have space. So we've also done creative things like that to make sure that the child gets to spend some time with mom as well, just not living here full time.
Thank you. Do you cover all substances, including marijuana?
Yes.
Okay, and there's a second time asking about the referral process. Can you just go over that again, please?
Sure. There is an email address that is listed on the last page of the PowerPoint. If you go ahead and send us an email to that email address, myself or one of my team members will reach out to you and walk you through that process. But what it typically looks like is sending clinical information to our admissions department, and we have it reviewed by our clinical manager and a nursing staff, and then they'll let you know, yes, they're cleared, and then our scheduler will go ahead and schedule with you. However, my team will be walking through that entire process with you, and we will be helping you manage it.
Yeah. How many residents can you have?
So we have 11 beds right now in our duplexes. But we also have an overflow unit with our women's residential program. So we have in our women's residential program, we have 80 beds, and that is also for other women, not just pregnant or postpartum women. So if we have an overflow over 11, we can temporarily place our pregnant women in our women's residential unit until space opens up in the duplex.
Okay. The next question is, can we have a copy of this webinar? And that is correct. Yes. The follow-up email will have a copy of the webinar. Okay. Is there case management or help with housing upon discharge?
Yes. So our case manager in the program works with the client on transitional planning at least 30 to 60 days before discharge. Unfortunately, due to the housing crisis that we're all experiencing, there are limited resources. We have sent people pretty far, like we've sent someone to Mount Dora. We have used some of our local resources, but they are all on really full waiting lists and long waiting lists. So we're having a hard time. So we are creative. One of the really good things about the program is mom is able to start working 3 months in the program. So she does have some income. So some of our moms have been able to fund their own apartment, or even a little duplex or a room somewhere, if they aren't able to go back to family. I would say about 60% of our women do go back to family members and stay with family members that they've previously been estranged from. We also make sure the family members are safe and good for a mom. I mean, we don't do a home visit, but we do make sure that we ask a lot of questions and kind of figure out their background before saying that's a good transition plan for mom. But and we do family counseling with the person that they're going to go home with, just to make sure that they're all going to get along really well. But it's worked really well for families to be reunited.
That's great. Let me check them on. Okay, so I have a few questions as well.
Sure.
And so you're really transparent about, like, for example, like the housing situation. And then we did hear about the success stories, so like the 10 families being able to maintain the family unit. But then how about some of the challenges? Are there any like cases you'd like to like kind of let us know about that you faced some challenges with the program?
Yeah, so we've definitely, like I said, halfway through the presentation, this is a 5-year program, and the first 2 years were pretty difficult trying to figure out what is a good balance for how to treat pregnant women, not treat them like the way that we treat them, but like how to provide treatment for them that would be beneficial for them and the baby. So there was a lot of teething issues. We've also had situations where mom just doesn't want to parent her child anymore and has left her child here, and we've had to call child protection, or we've realized that a mom may not be the most safest option for a baby, and we've had to call child protection. So it ultimately, we've had a lot of successes, but there have been some challenges over the years that when you're dealing with women who have substance abuse and mental health issues, there are going to be some things we need to do additionally to keep them safe. And of course, the entire team is heartbroken when we do have to call child protection, but we also know that making sure the babies are safe is #1 priority to us as well.
For sure. And so you mentioned that it's a 5-year program. So after the 5 years, what are some ways that you can maintain the program, like the family treatment services, to be sustainable?
Yeah, we have applied for a follow-up grant with SAMHSA, so we are keeping all our fingers crossed that we will get that grant. However, if we don't, there are some opportunities for pregnant women funding through our county and state that we will have to utilize. We might have to make some amendments of the program, but we are really happy with the model and we know it's serving our community well. So we are definitely committed to the model and the program.
Yes, that's good. And then in the beginning of the PowerPoint, you talked about the depression screenings. Have there been any mothers that have like not been compliant with that? And then if so, how does that situation affect their stay in the residential program?
Sure. Sometimes when women come in, they are a little bit resistant to services that we are offered. And we expect that because when you are first committing to becoming clean or entering your recovery journey, it's really difficult because using substances was the easier option. So what we'll do in those situations is a lot of patience, a lot of kindness. We utilize our recovery support specialists, and we'll revisit the situation. And usually by about week 2, mom has stopped being angry and mom's ready and realizes, hey, it's not a bad thing. Because sometimes when women come into residential, they look at it like a jail, or they're forced to be here, especially if they're placed by the courts. So we have to give them that time to kind of decompress, and also have those substances leave their system and kind of be able to think a little clearly. So we understand that they might need a little more time than others to be able to acclimate to the environment, and of course participate in all of the screenings that we want to do for their own health and safety.
Okay, thank you. So yes, if there's any more questions, please feel free to post in the question and answer function. Okay, we have one that just came in. How would you suggest my team to discuss and encourage this program to mothers dealing with substance abuse?
That is a really good question. I think sharing the successes and what could, it's a hard question, right? So like, how would you tell someone, hey, you need to go to residential treatment for 6 months, but focusing on their goals? Like, what are your goals for your child or your unborn baby? Do you want your unborn baby to be addicted to substances? Do you want them to be clean? Do you want to have a different lifestyle for your baby? So those are some of the, we call them motivational interviewing, but that's some of the stuff that we do for our women. So if you know, for example, if we have a mom that's in our outpatient treatment and clearly meets criteria for residential and doesn't want to go into treatment, some of the things we'll ask is, well, what do you want for your family? How do you want your family to look? And kind of motivate them from that angle. I can almost guarantee you any mom that we work with, even though they don't want to come into treatment, if they want to be a mom, they kind of look at what would be good for their baby. And sometimes we have to say to them, you know, if you don't do this, there's potential that DCF could get involved and there will be a negative outcome. This isn't us threatening you. This is just saying facts. We don't say that unless we really, really need to, but that's sometimes the ultimate and scary truth.
Yeah, the lens of, you know, this can really help your baby is really impactful, like healthy pregnancy.
Yeah.
And healthier outcomes.
Yeah. And ideally, women really do want the best for themselves and their kids. You know, women have an intrinsic nurturing tendency to want what's good for their kids.
Okay, we still have time. If there's any more questions or answers, please feel free to post in the question and answer box. Okay, that might be the last question.
And I also want to offer that if you are in Hillsborough County or in the surrounding areas and you would like an actual tour, we are more than willing. You can feel free to reach out to me. My contact information is on the PowerPoint, and I am happy to facilitate a tour for you.
Another question came through, and thank you so much for offering a tour as well.
Yeah, for sure.
Do you have any follow-up after the program, like after about a year?
So currently we have follow-up from USF with our evaluation pieces. So they do follow-ups just to see where the mom might be. But a lot of the times when mom leaves the program, we are referring them to another program, whether it's Healthy Start, Healthy Families, Nurse Family Partnership, or one of our internal programs. We are referring them. We're never usually just letting mom go after they finish our treatment program. And when we are hopefully getting this new grant, we are going to have a follow-up piece embedded into it where we follow mom for 3 to 6 months outside of the program.
And then we have some thank yous. This has been a really impactful, important information that you have given us. So yes, I also agree. Thank you so much. And yeah, I think we're going to conclude, but before, I'd like to say a little quick points. I'd like to thank everyone once again for joining us on this interesting webinar. If you would like information related to our marijuana pregnancy educational project, if you're interested in more information, we are going to send a follow-up email, and within that email will be a link that will lead you towards our dedicated webpage. Also, it'll be a follow-up email. And finally, please watch for the survey that will be sent to you shortly. We would appreciate it if you would complete as soon as possible. We will provide you with links to the recording and PowerPoint presentation. I know there's been a lot of requests for that, so just keep an eye out for that. It will lead you to the PowerPoint presentation from today's presentation within a couple of days. Within a couple of days, you also get an email with that recording and PowerPoint presentations. So thank you so much. This concludes our webinar.
Thank you, everybody.